Millions of prescriptions are being written for GLP-1 agonists, pharmaceuticals like Ozempic, targeting the metabolic symptoms of a population seeking rapid weight loss. This pace of weight loss has visible consequences. Doctors note a hollowed-out appearance in many patients, often referred to as Ozempic Face, where facial fat and skin elasticity are lost too quickly for the body to compensate. These drugs simulate satiation by mimicking natural hormones. They signal the brain to stop food noise, stimulate insulin production, and slow gastric motility, leaving food in the stomach far longer than a healthy digestive rhythm would allow. This forced suppression comes at a high metabolic price. Clinical studies show that up to 40% of the weight loss during semaglutide treatment is actually structural muscle mass rather than fat. A total system shutdown leads to a variety of complications. Patients report a persistent sense of apathy or a lack of motivation to engage in daily life. Others experience severe constipation, or in older populations, a concerning loss of bone mineral density. Treating metabolic dysfunction through forced starvation sacrifices the body's structural integrity. It masks the outward symptoms of the disease by shutting down physiological processes rather than repairing the underlying machinery. To repair that machinery, we have to look past the macroscopic symptom of weight gain and focus on the microscopic root cause, the failure of the cell's insulin receptor. In a healthy metabolism, insulin is a signaling hormone. It binds to specific receptor proteins on the cell's exterior to authorize the entry of energy. This schematic shows that molecular signaling. On the left, insulin binds the receptor, creating a jiggle, a change triggering a phosphorylation cascade. Moving right, that signal moves GLUT4 channels to the membrane. These doorways pull glucose from the bloodstream into the cell for energy. Chronic inflammation physically distorts this protein interaction. In a state of insulin resistance, the hormone may bind, but the receptor fails to trigger the necessary internal response. This creates simultaneous toxicity and starvation. Cells are surrounded by toxic excess blood sugar, yet internally starving for energy because the transport machinery is non-functional. A different approach focuses on repairing this cellular communication using berberine, a plant alkaloid found in species like the Oregon grape. This compound interacts with a protein called AMPK, the cell's primary metabolic sensor. Its role is to monitor when cellular energy levels drop. Berberine acts as an agonist for this sensor. It binds to the AMPK node and activates it, simulating a state of energy restriction. The cell responds as if it is fasting, initiating repair processes without the physical stress of actual starvation. Once active, this pathway facilitates the repair of the insulin receptors. Resensitizing these proteins allows the signaling cascade to function correctly again, restoring the cell's ability to clear sugar from the blood efficiently. This activation triggers wider systemic healing. It downregulates inflammation by inhibiting the NF-κB pathway and alters the gut microbiome to reduce the production of TMAO, a metabolite linked to arterial plaque. Instead of using pharmaceuticals to suppress digestion, this method works as a cellular technician. It restores metabolic efficiency and communication from the inside out. The biological results of these two strategies are starkly different. While appetite-suppressing drugs risk the loss of muscle and bone, activating the AMPK pathway helps the body optimize fuel use and preserve vital tissue. GLP-1 drugs do have medical utility. For patients with severe cardiometabolic risks or early-stage kidney disease, they provide a necessary intervention. However, using these drugs requires rigorous monitoring. Without lifestyle coaching and body composition tracking, pharmaceutical weight loss can lead to physical deterioration. True metabolic health is defined by functional efficiency, not just a decreasing number on a scale. Focusing on cellular restoration replaces the depletion of forced weight loss with a foundation for enduring health. By pairing metabolic agonists like berberine with lifestyle changes, we move from masking symptoms to restoring vibrant, functional systems.